Hi, this is Dr. Prashant from Reforme Medical, and in this video, I'm going to take you on a journey of facial aging using my beautiful friend Justine, who also is a clinic coordinator at Reforme Medical. And Justine has very kindly allowed for her pictures to be used. So here she's at 18 years of age, and what a beautiful face that is. Young, uh, full face, nicely placed brows, a nice fat pad under the brows, open eyes, a smooth sweep from the lower eyelid to the cheek, full lips, the vertical height, and a smooth sweep of the jawline from the lower cheek to the chin. She also is fuller in the middle third as compared to the lower third, giving her a nice taper of the jaw, which is one of the desired proportions um, in feminine beauty. So in this picture, she is 41 years of age, and uh, she has aged quite well, I would say, given uh, that it could have been uh, the descent of the brows and the fat loss could have been a lot worse. So she's quite maintained in terms of proportions, but no one can defy aging. And as a consequence, the skin has suffered. What you can't see in this picture is that she has got melasma, pigmentation. You can just about see it over here. And the reason why you can't see the pigmentation very well is because this is a picture taken after she's had an Obagi Blue Peel, where most of the pigmentation has been removed. And she is using at this point of time the Obagi Nuderm program to keep the pigmentation under control. But it's not just the skin that suffers. The fabric of the skin suffers, and she starts manifesting horizontal lines on the forehead. The fat pad under the eyebrows has reduced if you compare it with when she was younger. Uh, she has had a descent of the uh, tail of the eyebrow on both sides. So instead of being lower in the middle and then going up like gull wings, they are in a flat uh, position. Men, as you can see, my brows tend to have flatter brows, and women generally have a brow that arches upwards at its outer end. Uh, she has a loss of volume around the temples, around the tails of the brow, around the cheekbones. You can compare it with when she was younger. And what is happening, which is common to all people. I mean, if you can see, I have got a separation of my lower lid and the cheek, and there is a furrow running across my eyes. And similarly, she also has got a separation of the sweep from the lower eyelid to the cheek with the tear trough deformity showing up. The loss of fat under the eye and also on the high point of her cheek means that there is a relative excess of skin on the in the lower eyelid region, which causes these wrinkles. So wrinkles under the lower eyelid, a loss of volume, and a tear trough deformity, and where she did not have any nose to mouth lines when she was younger and when she was not smiling. Now the descent of the cheek fat pad um, has caused her to get these nose to mouth lines, or nasolabial folds as we call them. You will notice that she has a much lesser furrow on the left side, and that's to do with the fact that she has had Bell's palsy historically, where she had a temporary paralysis of her left-sided facial muscles, which recovered almost completely. So it has left her with a slight weakness on the left side of her face, and as a consequence, she has got less of a furrow. Now, one of the reasons why you get this appearance in the under eye area is not just to do with the descent of the fat pad, but also to the fact that the socket of the eye also opens up as the bone kind of resorbs. Similarly, there is a reduction in the thickness of the bone of the maxilla, and this curve of the maxilla kind of flattens back instead of being as she was when she was younger. This reduces the prominence of these we call them the filtral columns, these kind of pillars that you can see going from the bottom of the nose to the high point of the lip. And also you can see how beautiful her cupid's bow is of the upper lip. So she has got flattening of the filtral columns, these pillars, and she's also got a flattening of her cupid's bow. You will also notice that she's got a reduction in her vertical lip length on both the upper and lower lips, and as a consequence, her lips appear to be wider instead of how she was when she was younger. Uh, when she was, as we discussed before, she had this nice taper to her face, which now has gone, and she has got a widening of the lower third compared to the middle third. So it's almost like both the middle third and the lower third are the same width, giving this squarish appearance instead of the taper. This is a very common phenomenon, happens to all of us. What you will also notice is that there is now a break appearing between the sweep of the lower cheek to the chin. This we call the prejowl sulcus, and in some patients it also correlates with the marionette lines, or lines that run from the corner of the mouth to this uh, the prejowl sulcus, or this divot in between um, the jawline and the chin. So a short video to demonstrate. So here we try to match all the points on a face as best as we can, comparing both the 18-year-old photograph and the 41-year-old photograph. And you can see this whole deflation of the face, and also from a taper she goes to more of a square as she ages. You can see all of the things we discussed before. And just to highlight, here is her upper third. So you can see that whereas the tails of the brows used to be higher, like definitely not as coming as low as you can see in this area. She also has a little bit of laxity of the upper eyelid with age, and this might need to be corrected as well. So she needs to have restoration of volume. See how full her temples are, and how full the area around the eyes is, and how she's got hollowed out in all of these areas. Coming to the middle third, once again reiterating this change in the under eye in terms of volume loss, the change in the bone structure behind the cheek and around the eyes, and finally to the lower third, where you can see this prejowl sulcus opening up, the nose to mouth lines, the loss of vertical lip height. So this is what we can achieve, and hopefully we will be able to achieve once again the taper that she used to have at age 18, that we will be able to achieve the increase in lip height, um, which she has lost, making the pillars on the upper lip more prominent, uh, filling the under eye area, creating cheek high points, re-inflating the depleted fat pads under the brow to give them a nicer sweep, upward sweep that attractive faces have. So, having seen this video, we go to a still photograph of her at 50 years of age. So, over here she is 41, and over here she is 50. And what you will see is that we have started restoring the taper, we have started restoring the volume around uh, the high points of the cheek, the sweep from the lower eyelid to the her cheek is a smoother sweep compared to when she was actually younger. So this is a 10-year difference between the two photographs. You can see that now the having inflated the fat pad, the outer part of the brow sits a bit higher and a bit more natural. She's actually got almost no worry lines on her forehead because she's had regular anti-wrinkle injections. So chemical peels, skincare regime, anti-wrinkle injections, dermal fillers in under the brow, under the eyes, on the cheek high points, nose to mouth lines, and the lips. And the nicer thing is that it allows us to uh, re-establish these pillars, these filtered columns, and the arc of the cupid's bow, giving the lips a nicer appearance and generally restoring. The one thing we have not done for Justine yet is the pre-jowl sulcus, where we can kind of reduce this divot and make the sweep a smoother sweep as it was when she was younger. She has had Botox injections in the jaw, the masseter muscles, the chewing muscles, because with age you tend to bulk up on these muscles and they give you a masculine square appearance. She's had that too. So once again, highlighting all the issues we've had, we have discussed already, and the lips, the focus on the lips and how we have managed to restore the heights to how it was when she was 18. So this is a photograph of her now at 50. This one, to remind you, is at 18, and we have started um, restoring um, quite a few of the proportions which she had um, without any surgery, purely with non-surgical treatment. So this is very clearly a very elegant demonstration of how powerful non-surgical techniques are. And we would love to answer any questions you might have. Please put them in the messages, uh, or you can arrange for an online or in-clinic consultation with us. We would love to discuss your own beauty roadmap and help you best we can with either non-surgical or cosmetic surgical approaches to look fresher, to look more relaxed, to generally look younger and more vibrant. Uh, Thank you very much for the patient listening. See you at the clinic soon. Bye for now.